Katalemwa is a non-governmental organization involved in rehabilitation of children with disabilities. It is through the community-based rehabilitation that Katalemwa extends services to the beneficiaries in the communities. When I talk about beneficiaries, these are children with disabilities, among whom are with Spina Bifida and Hydrocephalus. Some of the activities that Katalemwa takes to the communities are those called outreach clinics, home visits, where it provides free rehabilitation services to children. You'll find that a child with Spina Bifida has to be on and off in hospital, has to undergo rehabilitation. Their operations, first of all, they are very expensive. And the therapies, they are not only once in a while, but it means almost lifetime. The parent has to keep on bringing the child to the center for the rehabilitation services or for the therapies. Spina Bifida, I can simply say it's a neurotube defect. It is as a result of inadequate folic acid in the diet of a mother or in the body of a pregnant mother. When the mother is pregnant, during the first 3 weeks of pregnancy, that is when the spine is formed in the child who is in the womb or the baby. So in case the mother doesn't have enough of folic acid and she's pregnant, the spine of the child will not be well formed and it results into a child born with Spina Bifida. Some people refer to it as vitamin B complex. So folic acid, especially when it comes to Spina Bifida, as a nutrient, it is very vital for the development of the spine. Folic acid can be found in foods such as avocado, can be found in mangoes, oranges, pawpaws, jackfruits. Most of the fruits, they have folic acid. Then we also have some foods like the greens, vegetables, they have folic acid, cabbages, nakati, and then we have also liver has folic acid, fresh beans, they have folic acid, but it's also important, however much that folic acid is in so many foods, it's important to take into consideration the preparation because it can easily be lost. That vitamin B complex can easily be lost if you don't prepare food very well. Hydrocephalus can be simply termed as accumulation of too much fluid on the brain, or it can be said water on the brain. You'll find that we have some brain cells that make up the brain. These brain cells, they keep on producing a fluid, and this fluid will pass through the spine and release off from our body as sweat, as urine. But you'll find that within the brain, we have some pathways, we have some spaces. And once this fluid does not flow very well because of the blockage in the pathways or the spaces within the brain, you'll find that the fluid will just accumulate and the child's head size will start increasing. The child will start feeling dizzy, will start feeling headache, the eyes will start changing like sunsetting, going down, veins will become pronounced and the fontanelle will become full. So once the mother notices those signs, we just know this is hydrocephalus, and it's very important for the mother to immediately take the child for an operation. Hydrocephalus is caused by so many things, among which are infections, can be caused by brain tumors, can also be caused by brain injuries or head injuries, and can as well be caused by Spina Bifida, because it's still the pathway of the fluid produced by the brain cells.
There is follow-up, there are trainings, there are other things that we do to those children to make them walk, to make them hold their heads up, because they fail at times after the operation. They need some physiotherapy to make them move on. We need to counsel those parents, because accepting that you have such a child is not something easy. And that is one of the biggest challenges I've got. Convincing a parent that you have produced this child and you must take care is not something easy. You go to parents several times explaining that, Madam, this is your own child, take care, and the parent will show you she's not bothered. She just wants that child to go. Most
of the Spina Bifida children, because of the reduced sensation, you find them, they are feet curved inwards, and they have to undergo orthopedic services to see that their feet are corrected. You also find that they have reduced sensation, meaning their muscles of the lower limbs, they are going to be weak. So spina bifida children, most times you'll find that they need to be supported with some appliances. For example, crutches. Auxiliary crutches, they are wooden in nature. They have to be supported with wheelchairs or walkers to be able to move from one place to another. And this is the child, whoever will be crawling from one place to another, however much has stepped on a pointed stone will not feel it. However much stepped on fire will not feel. So this child, most of them, they are on and off with pressure sores. Most of them, they have sores, wounds. And once they are not well managed, these children can later on develop what we call osteomyelitis, which is a bone infection. And really, osteomyelitis, most times it's very chronic and very dangerous. So that's also the secondary complication, which is very common, and most of the time we always help educate through their training the parents that they should manage. Let the children wear special shoes and protect them. Most parents that we have at Katalemwa, you find them, they are low-income earners. You find that what the spina bifida or hydrocephalus child needs in terms of rehabilitation costs of funds is far or doubles what she earns in a month. So you find them having challenges. They still have some challenges, but at least there are some support organizations who are coming up. For example, the International Federation. Actually, International Federation has been there for a long period of time. It supports these children, rehabilitation, their trainings, outreach clinics, home visits, to see that at least these parents are supported in raising up these children or rehabilitating them for good general health conditions.
Parents are very poor, and we don't have the projects so that we can get some money to sponsor or to look for materials to use as parents, because these children, mostly they use appliances, needs money and they are very expensive, so we lack money or funds.
As a result of inadequate knowledge about spina bifida and hydrocephalus in the community members, among our community members, most of our children, spina bifida and hydrocephalus, are facing stigma and discrimination. You'll find that they are given names in the community. When a child feels excluded from the community, you'll find that she cannot really participate in the communal activities. You'll find this child not going to school. Some schools do not accept children with spina bifida and hydrocephalus in their school. So this really hurts parents. So we are like, if we extend services to rural districts, at least it will help us create enough of the knowledge or increase the knowledge among our community members. Children really live longer if at all they are well rehabilitated and provided with all the necessary services.